humanitarian, socio-economic crisis that will exacerbate.
Setback of at least 5 years on issues of safeguarding women's rights.
In Africa, cumulative case has now exceeded 10 million and more than
inequalities, discrimination, social disparities, and
to double their efforts to stop the violence.
And more than 230,000 people have sadly died.
We need to make a difference in the lives of adolescents and young people.
In high conflict settings such as South Sudan, evidence-based parenting program can be highly effective in reducing the use of harsh discipline and improving positive parenting behavior.
We have brought together an emergency collaboration of United Nations agencies and hundreds of NGOs to adapt and deliver evidence-based playful parenting resources to prevent violence and help families cope. Our resources have been shared by over 240 organizations and in 34 national government responses across 198 countries.
This is a pandemic in every country that has experienced it, but these deaths have occurred in very short time periods. You can make the comparison to other disasters, other epidemics have not necessarily played out on these short time scales.
Well, the first urgent thing that we have to do is make sure that they don't go into an institution. There is very strong evidence that orphanages, institutions have very much higher rates of abuse, of sexual exploitation, that children's long-term outcomes are much more difficult. Governments are realizing how urgent this is and are coming to us, to colleagues at CDC, at USAID, at PEPFAR, at the World Bank, at WHO, to say, what are our next steps?
Precipitated feelings of fear, anxiety, and panic, and also relapse of mental health conditions. So there is therefore need for health policies and restructuring to ensure continuous provision of health services and medications.
I am extremely delighted that UNICEF wants to embrace mental health along with the World Health Organization. It's an awesome opportunity. I believe there's a revolution and it's going to spread and governments are going to listen and there's going to be a difference. People are going to enjoy good mental health, particularly our children. Change has finally come.
With the COVID impact, we know that schools are shut. We know that some of the most vulnerable children will not return because of poverty or being sort of pulled into work, both boys and girls.
The global education crisis was affecting adolescents in particular. 62 million of them, especially of lower secondary school age, were out of school, a figure that rises to almost 139 million for those of upper secondary school age. Many adolescent young women, specifically around the world, faced especially high risk of not only missing out on education, but also being married in childhood, early pregnancy, and domestic violence and abuse. Being out of school means not only a loss of learning and social development, but also threatens children's and adolescents' nutrition. School meals are often the only student's nutritious meal of the day.
What we know happens in poor context when people face a shock like that is they often take very short-term decisions that can end up trapping them in longer-term poverty. So one thing people can do is reduce children's nutritional intake.
There's reasonable evidence that supports the impact of cash transfers, cash grant programs on household food security.
As the World Food Programme, our mandate is to address food security and nutrition of the most vulnerable groups. It was thus important for us to understand HIV risks as they relate to food and nutrition security amongst adolescent girls and young women. I must say that our engagement with the hub has really helped us to strengthen evidence in this area and also inform our programming going forward.
The SDGs have forced us to realize that if we're going to have success for Africa's next generation, that we can't just be focusing on one single thing.
What is quite unique about our team is that we come at it from different theoretical perspectives and methodological approaches.
We want to validate our research by publishing in excellent journals so that when we hit policymakers in the face with it, we can say it was in Lancet Child and Adolescent Health, and 64 newspapers around the world reported it, so you better bloody listen too.